Yeah, so I want us to discuss assessment of a casualty. I believe you have seen these notes on the e-learning platform. Yeah, so how can you assess a casualty when you're managing? So basically, a casualty is a person who is on a certain incident. For example, maybe a person has injured himself or herself, or a person maybe is bleeding. He has a cut, he has a fracture. How do you handle a casualty? So in this case, I want us to discuss two main methods of assessment. One, we have primary assessment, and the other one is secondary assessment. Yeah, so basically, how can you be able to handle a casualty? So what are you expected to do once you have seen someone who is suffering, someone who is in need of first aid help? What are you supposed to do? So the first action should be, you're supposed to first you identify the response of the casualty. You're supposed to see whether a person is responsive, as in, can a person respond to you? So how can you do that? This is by, you can try to talk, as in, as you approach the casualty, a person who is on a certain incident, you need first to be talking to him or her and see whether he can be able to respond. Like, you can be asking him, what's your name? You try to tell him or her your name, who are you. Yeah, so in this case, you're trying to find out whether a person is conscious or unconscious, such that you can be able to know how to address the situation. Because, if a person is not conscious, or a person is, a person may be unconscious to an extent that a person is dead. So this is, you're trying to identify the condition of the casualty. So that is the first part of the primary assessment. First, to identify whether he's conscious or unconscious. If a person is unconscious, you may not be able to do a lot, such that in that case, you only need to put that person on in a recovery position. So we will discuss later on what is a recovery position and how can you be able to achieve it. Then on the primary assessment, we have three main steps that you're supposed to undertake. One is to identify you need to see whether a person is breathing. No, that is, you need to identify whether the airways are open. So you need to check on the person, for example, in the mouth, or on the nose. Could there be anything blocking the breathing? So how can you identify this? Is by, a person is speaking. If a person is speaking, it means the airways are okay. If a person is mourning, that person is breathing. Crying, or a person airways are open by, you can tell. You can even try to look at the nose, at the mouth, whether there could be any blockage. If a person is unresponsive, you're supposed to start to, as in, there is a photo here, I hope you can be able to see it, a person trying to tilt the head, and to see whether this person will be able to respond. Yeah. Then the other step is breathing. You check the breathing. So on the breathing, let me go to that diagram because it is a bit simpler, as in, it is simplifying everything. So you're supposed to check the breathing, the normal breathing on a casualty, every 5 to 10 seconds. And a person is breathing normally if air is moving into and out of the lungs and the chest is rising and falling in a normal, regular pattern. Someone who can speak or cry is breathing. These are just ways in which you can identify whether a person is breathing. So this is supposed to be done every 5 to 10 seconds. Remember, you're just giving first aid. So in this case, you must be waiting for an emergency help to arrive. So you're checking every 5 to 10 seconds as you wait for those people who are better qualified to arrive at the scene. So then the other step is check for circulation. So in this case, you're supposed to check at the person from head to toe for any signs of life-threatening bleeding. Bleeding, it's a sign. It's something that is risky, even when you identify it on a person. So if there is breathing, how can you be able to control that? We will discuss all this. How can you be able to control breathing? For example, by pressing hard on that area. So that is one way you can be able to control bleeding on a person. In this case, how you don't just press on a wound of a person, there is a way in which you need to do that to ensure that you don't infect it. Yeah, so we will discuss that into detail. So circulation, you can also check on the pulse rate of a person. In this case, on the pulse rate, you can check at either at the arm. There is a way in which you can be able to listen whether a person is having pulse rate, or at the neck. We will discuss much into detail later on. So here we're just trying to see how you can be able to assess a casualty. Once you have seen anyone on any incident, how can you be able to assist? So after we are through with this assessment now, that is when we will go to the like we will start with how can you be able to manage the bleedings, how can you be able to manage the cuts, scraps, deep wounds, and so on. And then once you have identified that there is no bleeding, or you have already controlled the bleeding, you're supposed to move on to the secondary assessment. Now, on the secondary assessment, this is where now you're supposed to, okay, there is this word sample. This term sample can help you to remember actually almost all the steps of secondary assessment. What are you supposed to do? So remember, this is the advance. After you're through with the ABC, A for airways, B for breathing, C for circulation. After you're through with the ABC, you progress to these steps now. So this, you're going in depth. You want really to understand what really happened, or what other signs and symptoms can we be able to identify on a casualty. So this term sample can help you to remember what are you really supposed to check on a casualty. Okay, the first S for the word sample, it is signs and symptoms. Signs are basically what you can observe. You as a first aider, what can you observe on a casualty? What changes in the body? If there is bleeding, you need to indicate somewhere that there is bleeding. If there is, for example, you can see a person, the person is not bleeding, but you can see somewhere on the skin, it is turning black, meaning there is clotting inside as in inside the skin, deep inside the skin. So meaning that's a risk. That's a risk, meaning that person may be having some internal bleeding somewhere in the body. Yeah, so you basically indicate what you're able to see. Then the symptoms is what the casualty will tell you, like how do they feel? Maybe there is somewhere they feel pain. So you need to also to indicate the symptoms which the casualty is able to feel. Then A is for allergies. So you need to ask the casualty whether they are allergic to any medication or any food, such that you just note down. Remember, you are the first person who is facing this casualty, and maybe you'll be the last person that this person will speak to. So you all need to note all these things. Then medications, the casualty may be on certain medications which need to be noted or which need to be taken during that time. For example, if you come across someone who is asthmatic and they are on asthma attacks, as a first aider, you can as well give a first aid at that juncture. So in this case, this person may be having inhalers in their bag. In most of the cases, you find that they always carry inhalers. So you need to take that inhaler and assist the casualty to use it. Or cases of, for example, diabetic patients, you find that at some point, they may just faint. And, for them, it's not just normal faint, because they won't wake up like a normal person, how they faint and wake up. So for this case now, you need to assist them. How do you assist a diabetic person? How do you assist a person who has fainted normally? As in, how can you be able to assist them to recover fast? So you need to tell whether a person is carrying any medication or was on any medication. Then P is for past medical history. Whether they are suffering from any conditions, or whether they have been as in on any medication on. Okay, you need to understand literally the medical history of a casualty. Then the last oral intake, food or drink, what they took last. Because you may find a case whereby a person is in a certain condition because they have not eaten, because they are hungry. So in that case, maybe food can be the solution, or sugar. And then events leading up to the emergency. What really happened? Why has a person fainted? Or what happened for this for the person to be bleeding. Basically, you're trying to find out the cause of the emergency. So those are the key things that you need to record under the secondary assessment. That is all about the secondary assessment. So all these other points are trying to expound on the same. For example, we have the vital signs. The vital signs such as the level of the responsiveness. Is the person alert, sleeping, or confused? Is the person responsive, changing? Breathing, skin changes, dry or wet, or unusual color or temperature. So these are things that you can be able to identify on a person, the vital signs. So this, remember, always when you're giving in a first aid, you should be recording somewhere such that when the emergency help arrive, or those people who are more qualified than you get to the scene, you need to hand over everything, since they are more qualified and they can handle the situation better. Then performing the injury check, okay, getting things like history, symptoms, signs. So like I've told you, these are just explanation on the word sample. So the symptoms, like I've said, these are the sensations that the casualty feel and describe to you. They are able to describe, those are the symptoms. But the signs, they are what you can observe, you as a first aider. That is the difference between signs and symptoms. Those are two different words. Yeah, so also you can identify some external clues that can help you to understand the nature of the emergency. So if you suspect drug abuse, take care, because he may be carrying a needle or a syringe, and maybe they can start reacting abnormally. So you may also find an appointment card for the hospital or clinic, or a card indicating the history of allergy, diabetes, or epilepsy. So like I was trying to explain about the medical history, these people may be having an underlying condition which need to be noted. So for a horseback rider or a cyclist, may carry such a card inside the riding hat or helmet. So they may be carrying cards may be having their details. So these are things that can help you to understand well about the nature of the emergency, like I've informed you. So the food and medication. So these are basically everything about the secondary assessment. The secondary assessment is in-depth, not just like the primary. Primary assessment, you're just trying to assess the nature of the injury briefly, like what can you really do very fast. So those are the two methods of assessment. The two methods of assessment. These are just things, the medical clues that can help you with the diagrams. I'm hoping you can be able to see the diagram. So here we have the medications, so you can be able to identify such things. Medical bracelets, we have people who have them, trying to show that they are suffering from a certain disease. And then inhaler, this is an inhaler. We also have insulin pen for diabetic. So this is something that you can be able to see maybe on their bag, in their bag. Then auto injectors. These are, okay, we have those people who are on some hormone, or as in they need some hormones in their body. So they can, for example, adrenaline. Adrenaline is a hormone. So they may be having such photo, which looks like, actually it looks like a marker pen, but it's an injector. They inject themselves with some hormones, though not common. Those things that are common is inhalers, the insulin pens, the bracelet, you may find them or in a medication. So how do you check for the level of responsiveness? So you may initially have noted whether or not a casualty is conscious. He may have spoken to you, or may made eye contact or some other gestures to show that they are conscious, or perhaps there may be no response to you or to your question, such as, okay, there may be response to your question or no response, such as maybe when you ask them, are you all right? Maybe they can respond to you, what happened? Or they may not respond. If they do not respond, it means that they are unconscious. But if a person is able to make eye contact, as in maybe through the eyes, they can be able to be explaining to you something. or maybe they can use their hands if they are able to do so. So if there is more than one casualty, you will need to prioritize those that must be treated first according to the severity of the injury. Use the primary survey ABC principle to do this. Remember, the unresponsive casualty are at greatest risk. Those who are not crying, those who are not shouting. So in this case, those who are unresponsive, they need to be taken care of, as in urgently, actually. You know, if a person, like we have said, you know, if a person who is crying, you know that they are breathing. A person who is mourning, you know that they are breathing. But a person who is unresponsive, they may have blocked their airways, or circulation is an issue, or breathing is an issue. So those are the people who you need to give a priority in any emergency scene. And then the other thing that need to be considered is the mechanism of the injuries. Why is this important? Because you know, the mechanism of injury is very key to understand. For example, if a person is on a car accident, you know, you don't need to move a casualty. Okay, in first aid, we always talk of a recovery position, but there is some situation whereby you cannot put a person on recovery position because you may be worsening their conditions, especially if a person's spinal cord is affected. If spinal cord is affected, there is, as in, you don't need to move them. You need to leave them in that position. Actually, you even need to support their head to ensure that they remain in that position until the medical help arrives. Because once you move, you're worsening the situation. That's why it's very, very important to understand the mechanism of the injuries. Yeah, so that's it. So this is basically the questions you can ask at the scene. That is when you're attending to the casualty. Or you can even ask those people who are standing around, maybe those people who are the witnesses. So witnesses are especially important if the casualty is unable to talk to you. The possible questions: was the casualty ejected from a vehicle? Maybe after the accident, he was like he moved out of the vehicle, or he was like the what is it called, the pressure, not the pressure but the force exerted on or depending on the mechanism of the injury or the accident. Maybe he moved out of the vehicles. Did the vehicle roll, and so on. So these are just sample questions which you can ask. And how if a person fall and hello, yes, yeah, oh, venye zia nizieke sawa. Okay, sawa, asante. Acha niangalie.